Many people wonder about the risks of HIV transmission through oral sex. This is a topic that often comes with a lot of confusion and misinformation. It's important to address these concerns with accurate information to ensure everyone can make informed decisions about their health. It's crucial to understand the difference between HIV and AIDS. HIV, or human immunodeficiency virus, is the virus that causes the condition known as AIDS, or acquired immunodeficiency syndrome. While they are related, they are not the same thing. HIV is the virus that attacks the immune system. Specifically, it targets the CD4 cells, which are a type of white blood cell that plays a significant role in protecting the body from infections. AIDS is the most advanced stage of HIV infection. It occurs when the immune system is severely damaged and the body can no longer fight off opportunistic infections and diseases. Oral sex does not directly transmit AIDS. This is a common misconception. AIDS is a condition that develops over time if HIV is left untreated. However, it can transmit HIV. The virus can be present in bodily fluids such as blood, semen, vaginal fluids, and breast milk, which can be exchanged during oral sex. The risk of getting HIV from oral sex is lower than from vaginal or anal sex. This is because the concentration of the virus in saliva is much lower compared to other bodily fluids. However, the risk is not zero, but it's important to know that any sexual activity without protection carries some risk. Using barriers such as condoms or dental dams can significantly reduce the risk of HIV transmission during oral sex. HIV is spread through certain body fluids. These fluids include blood, which can be present in the mouth due to bleeding gums or sores. Semen, which can be exchanged during oral sex, is another fluid that can carry the virus. Vaginal fluids and breast milk are also potential carriers of HIV. To understand how HIV is transmitted, we need to look at how it enters the body. The virus needs a point of entry to infect a person. HIV needs a point of entry to infect a person. This can be through cuts or sores in the mouth, which can provide a direct route for the virus to enter the bloodstream. This can be through cuts or sores in the mouth, which can be caused by dental issues or injuries. The virus can also enter through the vagina, where the mucous membranes are particularly susceptible to infection. It can also enter through the mucous membranes lining these areas. These membranes are found in the mouth, vagina, and rectum, and they can be vulnerable to infection if they come into contact with infected fluids. Knowing the facts about HIV transmission is the first step towards protecting yourself and your partners. Education and awareness are key in preventing the spread of HIV. In the following sections, we'll delve deeper into the specifics of oral sex and HIV transmission. We'll explore the various factors that can influence the risk and discuss ways to reduce it effectively. While oral sex carries a lower risk of HIV transmission compared to other forms of sexual activity, it's not risk-free. The virus can be present in infected bodily fluids like blood, semen, vaginal fluids, and breast milk. During oral sex, these fluids can come into contact with the mucous membranes in the mouth, providing a potential route of entry for HIV. The risk of HIV transmission through oral sex depends on several factors. These can include the type of oral sex, the viral load of the infected person, and the presence of any sores or cuts in the mouth. It's crucial to remember that even a low risk is still a risk. Engaging in safer sex practices is essential to minimize the chances of HIV transmission. We'll explore these protective measures in detail in the upcoming sections. Several factors can heighten the risk of HIV transmission during oral sex. It's crucial to be aware of these factors to take appropriate precautions and protect your health. Understanding these factors is key to making informed decisions about your sexual health. Knowledge empowers you to take control and make safer choices. One significant factor is the presence of open sores or cuts in the mouth. These can be caused by various reasons, such as accidental bites, dental procedures, or even certain foods. These sores can act as entry points for the virus, making transmission more likely. It's important to regularly check your mouth for any abnormalities and seek medical advice if needed. Similarly, bleeding gums, which can occur from brushing too hard or gum disease, can also increase vulnerability. Maintaining good oral hygiene and visiting the dentist regularly can help prevent these issues. The viral load of the infected person plays a critical role. Viral load refers to the amount of HIV present in the blood and other bodily fluids. A higher viral load means there is more of the virus present in their bodily fluids, increasing the chances of transmission. Regular monitoring and treatment are essential for managing viral load. This is why it's so important for individuals living with HIV to adhere to their medication. Effective treatment can suppress the viral load to undetectable levels, significantly reducing the risk of transmission. Consistency in taking medication is key to maintaining a low viral load. Additionally, the presence of other sexually transmitted infections, or STIs, can elevate the risk. STIs can compromise the integrity of mucous membranes, making it easier for HIV to enter the body. STIs can cause inflammation and sores, making it easier for HIV to enter the body. Regular screening and prompt treatment of STIs are crucial in reducing this risk. We'll discuss this further in a later section. Stay informed and proactive about your health to minimize risks and maintain well-being. Minimizing the risk. Protective measures for safer intimacy. In today's world, where awareness about sexual health is more critical than ever, understanding and implementing protective measures can make a significant difference in maintaining a healthy and fulfilling intimate life. Taking proactive steps to reduce the risk of HIV transmission during oral sex is crucial for protecting yourself and your partners. This involves not only understanding the risks, but also being aware of the various methods available to mitigate them. Fortunately, there are several effective methods available. These methods are designed to provide a barrier against the transmission of HIV and other sexually transmitted infections, STIs, ensuring that intimacy remains safe and enjoyable. Condoms typically associated with vaginal or anal sex can also be used for oral sex. They are one of the most accessible and widely recognized forms of protection. When used correctly, they can significantly reduce the risk of transmission. When used correctly and consistently, condoms provide a barrier that prevents contact with bodily fluids, significantly lowering the risk of HIV and other STI transmission. It's important to follow the instructions on the packaging and ensure that the condom is used throughout the entire sexual activity. Specifically designed for oral sex, dental dams are thin, square pieces of latex or polyurethane. They are an excellent alternative for those who prefer not to use condoms during oral sex. They act as a barrier between the mouth and the genitals or anus, minimizing the risk of fluid exchange. Dental dams are easy to use and can be an effective way to protect against STIs during oral sex. Another essential practice is regular STI testing. Regular testing helps in early detection and treatment of infections, which is crucial for maintaining sexual health. Knowing your status and that of your partner allows you to make informed decisions about your sexual health. Open communication with your partner about testing and results can build trust and ensure that both of you are taking the necessary precautions. Remember, while these methods can significantly reduce the risk, they do not eliminate it entirely. It's important to stay informed and continue practicing safe sex. Combining these strategies with other preventive measures, which we'll discuss in the following sections, offers the most comprehensive protection. This includes understanding the importance of communication, consent, and mutual respect in any intimate relationship. By staying informed and proactive, you can enjoy a safer and more fulfilling intimate life. Pre-exposure prophylaxis, or PrEP, is a revolutionary medication that can dramatically reduce the risk of HIV infection. Taken daily as prescribed, PrEP helps to prevent the virus from establishing itself in the body. PrEP is highly effective for individuals at higher risk of HIV exposure, such as those with partners living with HIV or those who engage in frequent condomless sex. Studies have shown that PrEP can reduce the risk of HIV infection from sex by up to 99% when taken consistently. It's important to consult with a healthcare professional to determine if PrEP is right for you. They can assess your individual risk factors and provide guidance on the proper usage and potential side effects. While PrEP is a game changer in HIV prevention, it's essential to remember that it does not protect against other STIs. Using condoms and other protective measures remains crucial for comprehensive sexual health. Post-exposure prophylaxis, or PEE, is a course of medication taken for 28 days after a potential exposure. It works by stopping the virus from replicating and establishing infection. To be effective, PEP must be started within 72 hours of the potential exposure, and the sooner, the better. If you believe you may have been exposed to HIV, it's crucial to seek medical attention immediately. A healthcare provider can assess the situation, determine your risk level, and prescribe PEP if necessary. PEP is not a substitute for regular HIV prevention methods like PrEP or condoms. However, it serves as a vital safety net in emergency situations, potentially preventing a lifelong infection.